The next layer that we're going to use is the light incisal microfill. I'm going to use this to be able to create that translucency towards the incisal third. Now, for the microfills, I prefer not to use them out of the compule. What I'd like to do is eject a composite onto a pad, roll it into a specific shape that I need that I'll show you, and then from the pad bring the composite to the tooth. So, using my resin keeper, I'm going to squeeze out that first little bit and discard that. I'm going to clean my gloved finger with an alcohol gauze. I'm going to roll this composite with my clean glove. I'm going to get all the wrinkles out from taking it out of the compule into sort of this ellipse form, sort of like a cigar-shaped form. I'm going to use my IPC instrument, that's that super thin instrument. I want to inspect it, make sure there's no little things floating in there. And I'm going to take that little ellipse and I'm going to bring it to the tooth. I'm going to bring it to the tooth, place it over the incisal third. I'm going to clean my gloved finger again. That's very important. I'm going to clean my gloved finger. And then I'm going to compress that composite into that incisal third. After I use my finger to compress that composite, then I can come back with my IPC instrument. And now I want to blend this composite onto the tooth form using my alcohol gauze to keep my instrument clean. Now remember, for the incisal or the gingival half to gingival 2/3 of the tooth is going to be with our A1 microfill, but the incisal third to incisal half is going to be with this incisal microfill. This blends in to the composite from that palatal shell over the edge of the tooth. And again, I'm using this IPC to cleave off the excess composite. Coming over to the mesial now, blending that in. Like so. Then I can use a combination of my multi-use instrument to blend that on to the tooth surface. I want to get this as smooth as I can. And again, I'll come back with that IPC. I'm bringing that material interproximal to blend into that lingual wall. With this incisal composite, we're going to start establishing this proximal contact. We want this composite to go right to this unetched proximal surface on the canine, and the same on the central, and then same on the canine. All right, we're just going to look from the incisal view. It looks like we're pretty close to full contour on that incisal half of the tooth. That's great. Getting that contact established. And now we're going to cure that, and then we're going to add that last layer of the A1 microfill that's going to take care of that cervical third and blend over top of this composite that we've just placed. So let's cure that for 10 seconds. All right, see you at the next section.